AM 1220, KHTS, HometownStation.com. I am T, here with you with Dr. Proctor. We're here every Thursday from noon to 1. It's an opportunity for us to glance over the shoulders of medical professionals and support staff so that we can learn a little about what they're up to, things that will affect us. I always say that now that the Affordable Health Care Act gives people more opportunity to reach out to doctors and professionals, it impacts their business more than you might realize. And as a result, it is most important that we become advocates for ourselves and our well-being and the loved ones around us. The more we can come to the doctors, the better prepared we are. And really and honestly, the healthier we are, the better it allows the medical community to take care of us. And with the silver tsunami, another thing that's been talked about quite a bit in the media, as the population ages, there will become issues that will need to be attended to. And if we can be at least a little more understanding and educated, it will help us help ourselves. To that end, with me today, I have Armand Almario. He is the CEO, Administrator, and Director of Patient Care Services and an RN with Cardinal Home Healthcare. Also with him, he has brought Glody, who is his office manager. She's an LVN, also with Cardinal Home Healthcare. And Rick Ferrante, who's the President of the Home Healthcare Services. And this is the subject I'd like to cover today, a little bit about what it is to have medical home healthcare. So everyone, thank you for being here today. I'm happy to see you.
Thanks for having us.
Thank you for having us.
Now, medical home health. We have talked before here on the show, Rick, and you've heard other healthcare professionals going into the doctors or dealing with situations, but there often comes a time in our healthcare where home is involved. So can you help me out? I'd love to just describe the basic definition of what that is, right. And then we'll talk a little bit about the functions and what we're talking about.
Right. So that's just it. We're talking about home. Okay. So you've got a whole range of things when you have somebody in a hospital, when you have a whole range of things when you have somebody at a nursing home or whatever the situation is. But there is a whole litany of things and things to consider, understand, be educated about when you're dealing with a loved one yourself or a loved one at home.
Now, one of the things I know in speaking with individuals, it's a very frightening prospect, the idea that, I've heard it over and over again, if I have a relative who's ill or I just want to be in the facility or I want to stay in the hospital, and I know there are a number of reasons to not do that. My grandmother used to say, she lived to be 107, I don't want to go to the hospital, that's where the sick people are. There's something to be said for that, because the longer you're there, the more your immune system is compromised. There are staph infections. There are things. It's sometimes not in the patient's best interest to be in a long-term situation like that. And a lot of times, even for morale, coming home is the best thing you can do. But it's a scary idea, and I've seen people like deers in the headlight going, well, I don't know that I want to do that if it's me, or I don't know that I want to bring mom or aunt or grandma home because I don't even know what that means.
Right. So you hit the nail on the head. The two things, right? So you have the sort of clinical side of it and people and what their outcomes are and the results. So if you have people that are discharged from a hospital or in a situation where they need care and they have that option of, and there are certain times where a convalescent home and a stay and that kind of thing is important. But if they have options, you're right, for both the clinical side, the outcomes are always better if there's somebody's at home. And the mental and the emotional state of somebody has a big effect on that. And you just look at a normal person and yourself or anybody else. Where would you rather be? Or would you rather be? Yeah, would you rather be down the halls of a hospital, or would you rather be at your house, but have that care? So the way we always look at it is this. Okay, so you're discharged, either you or a lot of times, like we have said, is your loved one. Okay, mom, dad, aunt, uncle, grandma, whatever. Walking out of that hospital in a wheelchair or whatever it is, and then saying, okay, what do I do now? Now what? Or during that discharge planning phase.
And there's so many little things that you wouldn't think of.
Yeah, and you don't have to know all of it 100%. but you have to know what those options are. So medical home health, what about palliative? Is it a hospice situation? What do we talk about in terms of non-medical home health and having caregivers? And, all down the line of all the things that you need. So you kind of have to know what's out there, what's available, and then just at least know those options.
Right.
And that's the kind of what we're trying to do here today. So in terms of looking at it all, we have, Cardinal Home Health is the home and medical side of that, and then we do the non-medical side of that.
Now, what is that? Walk me through what does that mean? Non-medical home care.
Well, on the non-medical side, basically these are caregivers. These are people that are not doctors or nurses. Okay, because your insurances,
so it's a distinction of who's taking care of you.
Exactly. Now, so what most people need, or a lot of people need when they go home, is they need a nurse, or they need doctor-directed and nurse-directed care.
For example, if there's equipment or there are issues that need medical attention.
All kinds of things. And Armand can go into some of that on the medical side. But then there's the rest of the time when either family or professional care need to be helping if that's what the need is. And so you don't, put a doctor, you don't put a nurse onto somebody who and that cares for somebody 24/7 or needs, 8 hours a day or something like that. And that's where the caregivers come in. But they work together, T. I mean, these along with your doctor, along with everybody else, coordinate, integrate so that all the way through the process you have a continuity of care. But truly what non-medical home care is that non-medical, so it's not nurses, it's not doctors, but it's experienced care, people who know what they're doing, and then they kind of work with the family, who in a lot of cases are those caregivers as well.
Okay, so then let's talk a little bit, Armand, Almario, and Glody. Let's talk a little bit about Cardinal Home Health Care. What is your role when it comes to patients?
We are a professional certified by Medicare as well as licensed by the state. We provide nurses, physical therapists, occupational therapists, speech language pathologists, social worker assistants, and caregiver, some assistants at home. But we coordinate primarily with our clients' physicians, and we coordinate in terms of their medication needs through the pharmacy, and as well as equipment needs through their DME companies.
Now, before we came on air today, we talked a little bit about patients and how they can somehow be pressured to do things that aren't in their best interest medically. Can you elaborate a little bit on that?
There's a lot of issues out there. There's a lot of questions and fear. Which if I'm a senior and I'm aging, I know I'm gonna need a lot of health. I'm gonna be in a lot of healthcare needs eventually.
And we're all in that spot.
Right.
Again, talking about the silver tsunami. This is a population, a very large portion of the population that is going to age into the possibility of care. It'd be wonderful if we all just had that great mindset and the great gene pool that we didn't have any issues, but chances are issues are going to come up.
Right.
So, and I think we're all a little fearful.
Right.
The idea that it's confusing. There's a lot of confusion right now how to take care of ourselves, and when it comes to insurance and what we should be. And you had some advice to that end, didn't you?
Right. I always advise our patients to grab hold of their control of their healthcare needs by keeping their insurance primary Medicare traditional, and then have a private insurance to take care of the 20% cost of their health needs through either a private insurance, or if they cannot afford it, if they qualify for Medi-Cal, keep it as a medical HMO or traditional Medi-Cal, and that's the best insurance that they can have because they will
they're covered on a lot of bases, aren't they?
Right. Medicare takes care of the 80%, 20% is taken care for by this private insurance or Medi-Cal if they qualify for it.
And one of the last things you need when you're not feeling well is the idea that you now have to deal with the business end of it.
Right.
So take care of it in advance before something like that happens.
Keeping your primary insurance Medicare, you will have more access to health care. you have more choice. You have control of your healthcare needs through your physicians.
Now, Rick, talk to me a little bit about situations where patients and families, how do they go about thinking,
Yeah, so what you're doing is
differences.
you have this situation where you got a discharge, or you have a situation where the doctor says that you need, some care in your home. So that's where you've got to start by looking at to say, okay, where am I fitting in as a family, as the family members? Okay, so son or daughter being doing something, care, doing hours of certain times. Where is other friends and family?
It becomes a business in a way, doesn't it?
Because there's an organization there.
It's charts and graphs.
Yeah.
In order to know who's during this time period, who's during that period, and then having everything set up in the way you're talking about.
Yeah.
You have to be practical and pragmatic about it.
And so you look at it with home health and then family and non-medical. So the home health will come in, certain couple of times a week, certain amount of time, 45 minutes or
That's
so,
right. That's right.
each time, and then they're going to come in and they're going to do physical therapy, or they're going to do, wound care, whatever, depending on the situation. And that's what's covered, and that's what they do. And okay, at that point, hour later, right, they're gone. Mm-hmm. Now what? So somebody needs to kind of take that from there and say, okay, the exercises, the diet, the medications, all the things that were instructed by home health and the doctors need to actually get done. We need to understand what it is that's happening when they do this. Okay, so they're eating, yes, somebody's eating, somebody's doing the exercises, somebody's taking the medications, the appropriate ones, which can be extremely confusing. The medications themselves, we can talk about that forever. Just medication management.
Just the motivation for therapies and things when you don't feel good. That's a tough one.
So if you're sitting in a room, really the ideal, which you can't ever do, is to put everybody in a room. Here's the doctor, here's home health, here's the non-medical, here's the professional caregivers and the
good luck with
good luck,
schedules.
right? And then the family and the patient, right?
I try to schedule a doctor on Thursday, Rick. So
Yeah.
I get.
It's not
I
gonna
can't
work.
imagine.
It's not going to work. But what you got to think about it that way. If everybody's in the room, can't be, but maybe we can communicate so that everybody knows the same things. So we know.
You sort of need a point person.
Yeah. So you come in and whoever that point person is, and look to find that advocate. There's case managers at Cardinal Home Health that can do that. There's case managers here at Home Care Services that can do that. Whoever you're working with, I don't care whether you're here or in Florida. Find that case manager that will then look to guide all of that, including the family. Okay, so they need to know just as much. You need to know. You need to understand what those physical exercises are and what that medication is as the son or daughter, so that you can become a qualified caregiver as well. If you can, you want to try to get some respite from a professional caregiver, and then you have your home health and everybody else involved. But just picture this as if everybody's in the room, and then they're all working on that same page. And part of it too is not just today when it first starts, but it's after a period of time. What have been the results?
Follow up.
Yes, and are we going up? Are we going down? Are we the same? Are these things happening? Do we have to change?
We need to change something.
This isn't a machine, folks. This is an art. You can't expect, okay, now I'm done, right? With care's done for grandma, done. We've got it all done. You got to come back and say, is this working? Is this happening? Is she doing it?
Now, let me ask you a question. Let's say, myself, my mother, my grandmother, someone goes to the hospital, they've had some surgery or they have an issue, a chronic situation that they need to deal with. I think most people, the idea is, okay, when I get discharged from the hospital, they're going to tell me all that. That's fallacy, right? That doesn't really happen. They sort of make how do we find the right people to help us? And is it a situation of the optimum health care as opposed to being released with a slip of paper saying, okay, this is what you need to do. Oh, wait, now how do I know about how am I going to find places? Now, I can probably go on the internet and I can find Cardinal Home Health Care at cardinalhhc.com, or I can find you and your company at homecaresantaclarita.com. But if I'm somewhere, maybe I'm outside of the area, or what's that scenario look like?
Right. So one of the things that Armand said was taking control of your, it would be great if somebody sat there and just guided you through this entire process.
That doesn't
It
usually-
doesn't happen.
Yeah.
So you have to take control, and you have to go out and find that advocates that can do this for you, all right? So that can kind of point you into all those directions, but not separately, where I go and get one, I get another.
Right, because then now it's piecemeal. People aren't
Yes.
communicating. I
Right.
mean, even in a really well-run company, we know that's important. People have to communicate. People have to have meetings. People have to kind of follow up on something. So I can't imagine piecemealing your healthcare together.
Right.
And I think Armand and Glody would be able to speak on the home health side of in terms of discharge and the doctor and what they're saying in terms of requirement or need for home health or options.
If we have a caregiver at home with a family and the patient, it's easier for us to coordinate all the services. For example, if the patient is going to be discharged from the hospital, if we have a designated caregiver at home, then this case, the discharge planner from the hospital can coordinate with a caregiver who probably has, if this caregiver has knowledge or already experienced this home health agency that they worked with before, it's easier for us to coordinate everything.
But let's say you have a family where it's a mother and a father, and they've got 2 little kids, and they're not really qualified to do this. They're just your average Jane or Jack who says, no, we're making room for mom, aunt, grandma, and we don't really know how to do any of this. Are you prepared? Does your company also say, okay, well, let's take a look at this, and we're going to help you become a caregiver? Not everybody's born a caregiver or is happy to take on that role. It's frightening.
Right. It's our job to explain or advocate these issues to a family member and educate them on how to take care of this. And
you help them become a caregiver.
Right. We help them to become a caregiver.
Because that's an important distinction. I think a lot of people, that's not the hat they necessarily want to put on, because it is very frightening and overwhelming, and the emotions.
It is.
Very nice that you're there to help them figure out how to be that person.
Right. For example, a patient gets discharged from the hospital. If we have this patient in our service, right after discharge, we take care, even before the patient is discharged from the hospital, everything is taken care for. Supplies, oxygens, all these things, assistive devices. We coordinate with the primary care physician, the physician in the hospital, the discharge planner in the hospital. We coordinate all these services so when the patient gets home, everything is ready. Now, if this patient requires a non-skilled caregiver, we have home care services through Rick Ferrante, and then coordinate all this and have this ready at the patient for enough time for the patient to be able to do it themselves, or the family to be able to do it
and
themselves.
how wonderful to know that, because again, the idea of being in the hospital and having you have a staff around you, there is some comfort in that. There is I know a lot of people, there's great security knowing that everybody in the white coats and the fabulous pink scrubs are going to deal with everything. You're going to send me home to the people that I live with that sometimes we burn water? What? The idea that you're going to be there to help the families and walk them through that and know what they need, when they need it, and coordinate it. And again, I think it's important to emphasize that for a lot of patients, being home is often, it's a better morale booster. It's better for their immune system. It's better for them to actually rest. I've been in the hospital. Beep, 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 that's not my, it's very stressful being in the hospital. Being home is the better place, but I think the concept of being at home is also a little stressful. We're going to talk about that when we come back. We're here with Rick Ferrante from Home Healthcare Services, also Armand Almario and Glody Almario from Cardinal Home Healthcare, and you can find both of these entities at cardinalhhc.com for Cardinal Home Healthcare, and Home Healthcare Services can be found at homecaresantaclarita.com. This is Dr. Proctor. We'll be back after these messages.